Tucker Wellness and Recovery offers outpatient services as a continuation of care for Tucker Pavilion. Partial Hospitalization is a program that can offer a high level of support for individuals that may be experiencing severe depression, anxiety, mood instability, or even some self-injury behavior. So when symptoms are interfering with functioning at work, school, or personal relationships, then it's a good time to come to us. We're here to not only help you get through a crisis, but you're also learning skills that you can carry forward for whatever's next in your life. Our goal is to help you take the reins back in your recovery process. We have an adolescent program that serves individuals from 13 to 17, and an adult program that serves individuals from 18 and up. People come to us Monday through Friday, 8:30 to 3:30, generally for about 2 weeks, but it really depends on each individual. Individuals attend 5 groups a day, building skills, gaining some insights, and meeting with a psychiatrist twice a week to evaluate medications to also aid in that part of managing your symptoms. Some people come to us from inpatient hospitalization programs. It's a way of continuing their progress. Others may be referred to us from their outpatient therapist or other providers as a way of trying to prevent hospitalization. We understand that mental health recovery is not always a linear process. Symptoms may reemerge. We encourage people to see us as a resource. You don't have to come through the emergency department. You can come directly to us. Just give us a call.
Hi, my name is Hope. I am one of the therapists at the Partial Hospitalization Program. Our morning begins with processing about our current concerns with our patients. We then talk about GLADs. GLAD is a mindfulness tool created by Donald Altman. The G stands for gratitude, the L stands for something that the patient has learned, the A stands for an accomplishment, and the D stands for delight. We added a positive quality to work on self-worth and self-esteem with our patients. Other groups that we facilitate are cognitive behavior therapy groups and dialectical behavior therapy groups. We do a lot of coping skills in our groups. We do grounding techniques, mindfulness techniques, and we do processing at the end of the day to talk about positives from the day and any negatives that occurred throughout the day.
First and foremost, we really believe that our treatment should be driven by our patients. So from day one, our patients come in and complete a treatment plan worksheet with our nurse where they use their own language to describe some of their goals or some changes they'd like to see while they're here. By the second or third day, the patient will meet with me, the individual counselor, or Hope, and we'll come up with a little more collaborative goals. We'll use the patient's language and we'll use a more measurable system to come up with kind of how we can see that growth while the patient's here. Secondly, we really believe that it's important to involve the patient's support system. It is voluntary, so whoever that could be, whether that's a parent or just a best friend, it's really up to the patient. We'd love to have that person in and just collaborate with them and kind of let them know what the plan is moving forward. Another thing that we find really important here is that we can help multiple types of individuals. Our groups are not oriented just towards depression or anxiety. One of my favorite things since coming over to work at Tucker Wellness and Recovery is the growth that we get to see in our patients. We really do see positive improvement. We see folks who come in and they learn the coping skills and they learn how to practice some mindfulness and they put them into practice in their normal lives, and we really see them leave in quite a different state than they came in.
My experience with PHP was fantastic. I was hesitant about coming here, spent some time with Peter talking through my personal situation, and he thought it would make a world of difference, and he was right. Everything from my experience with the staff and counselor team here to my peers that were in group counseling really made a large and profound difference in my life. And I learned valuable tools I still use every day. It's made me a better person. It's made me better at work, better with my family, and I think emotionally stronger. Where I thought this would be a sign of weakness by coming here was actually my moment of strength, and I'm grateful that I've done it, and I'm grateful for all the support and everything that I've learned, from the tools to the reminders and the memories of everything that I learned and gained while I was here. And I've made friends that I will have forever. So my experience while at PHP was top-notch. It's never a sign of weakness to ask for help, and you're going to be better for it. And by getting into a supportive group that listens, that provides thoughtful instruction, tools, offers advice and tips, in a support network, you're going to be better for it. I felt like I was much better prepared to deal with everything that you encounter in life, and prior struggles were not necessarily easier to handle, but I was able to process them and move on much quicker, which I would not have been able to do without the support of staff and my peers here at PHP. Perhaps the most helpful piece while here was the part that I was most unsettled about, which was group counseling. I was unsettled at best coming here, and then even more so with the prospect of group counseling. And while in group counseling, not only did you get to share everything that you felt and your perspective with the staff and counselors, you also were sharing that with your peers. And the combination of staff feedback and then feedback from your peers and the support of both of those groups, you just couldn't match. And all of a sudden you quickly realize that you've got a much broader support network to lean on, to ask for help, to ask for perspective, and that can't be measured. And that same peer support group that was here remains that way long after I've left this program. And those folks, for as long as they'll allow me to lean, will continue to be a support group that I'll carry through for the rest of my life. It's difficult to explain the impact that my time here has had on me personally. It has made a profound difference, and I owe a lot of that to the folks here at the program, my peers that I went through the program with, and everything that I individually accomplished. I consider myself much stronger and better for it, for coming here. I'm better with my family, I'm better at my job. I've got an outlook that's totally different from when I came. And so in that regard, you do realize it's okay to ask for help. You can get better, you will get better, and it's an experience that you can look back on and say, hey, that was a time in my life that I really grew.
When people come in for an assessment, I always tell them it takes a lot of courage to do that. There's a lot of uncertainty involved in seeking mental health treatment. It may be your first experience ever trying to access the mental health system. And I like to tell people that we provide a safe, supportive, and structured environment where you can begin your journey of healing and recovery and getting you back to an optimum level of functioning. Getting access to our program is as simple as making a phone call. Simply call our office and we will set up an assessment for you within 1 to 2 days. Ideally, we'll be able to start you in the program the day after your assessment. During the assessment process, we'll ask you questions about what your needs and what your symptoms are. Together, we will determine if our program will be a good fit for you.